In 3 words, tell me what breastfeeding means to you.
Breastfeeding to me means prevention, improved health outcomes, and support. I work as a registered dietitian in Indian Health Service, and my master's was in public health, so my focus has always been at a macro level, what can we do to educate our population on things that improve health outcomes of our people. And breastfeeding was just kind of a natural segue into that. And working as a registered dietitian, I was providing nutrition education to patients who had gestational diabetes and had type 2 diabetes and who were currently pregnant, and decided that becoming a certified lactation counselor was really needed. The certified lactation counselor program is great for anyone looking for kind of a quick way to kind of get into lactation, because it was a week-long program I went to. I got the training, and then once you're certified, you have to recertify every 3 years by showing a certain amount of continuing education credits. And to me, that the education out there that is there for lactation is very evidence-based, and that's what all of us should be working towards in our practice, is evidence-based medicine and evidence-based education. Earlier intervention is what we need, and there's no better time than when the mother is pregnant, and because you're benefiting both the child and the mother. Becoming a certified lactation counselor is a great opportunity for educators in rural areas, because it's just an added support that currently isn't in most rural areas. And some of our patients are having to drive. If they want that support for breastfeeding, they may have to drive as far as 2 hours one way to get that support. And when we're wanting increased initiation of breastfeeding and increased duration of breastfeeding, we really need to have that support in our own communities. When I started working in diabetes prevention through the STPI grant, which is the Special Diabetes Program for Indian grant, early on in my career, I realized that if I'm already working with patients who have gestational diabetes and pre-existing type 2 diabetes, it's a great opportunity for that education, for breastfeeding support and education, just for the mere fact that there's so many research studies that indicate that there's a positive correlation between decreased risk of diabetes later in life for mothers who have gestational diabetes, as well as for the children who are breastfed, for reduction in diabetes and type 2 diabetes. So it was an easy avenue for me to decide that this is important. We need to do more breastfeeding education and offer more support for our patients who are either living with diabetes or have gestational diabetes during pregnancy. Working in Indian Health Service, I realized that a lot of mothers that come to our facilities need a place that they can go to breastfeed and also just have that support. I think just out there in our environment, the more we support our moms, the longer the duration of breastfeeding. And so when I worked at the Wagner Indian Health Service, one of the things I started was a lactation room. There wasn't one there currently, and at that time, I really had to fight for that space, because it wasn't something that was on everybody's radar, that breastfeeding prevents diabetes. We have the highest incidence of diabetes in the entire nation in the Indian country, and this is just something that would just provide further support for those mothers. And so part of that, I wanted to do a big ceremony to honor that room and honor the mothers who would be using that room and the children that would be using that room. And so we did a ceremony to open the lactation room, along with we had a drum group come and do an honoring song, and we had our CEO at the time, he did a prayer for the room, and it was just a really beautiful day with just that promotion of that room. And I found that it would be helpful to the employee to have a specific policy for our facility. So at Wagner IHS and Cheyenne River Health Center, I created a policy and let employees know that this is available for support, and that you have that support in our facility, so that you can be successful as a mother and an employee, which ultimately leads to the success of us as an organization and the child. I've also worked with the providers to educate them on what medications are safe to use while a mother is breastfeeding, so that they can provide the best care to our patients. I love providing a mother support and education prenatally, and having them return to me for further support postpartum. And then I get to see the baby, of course. And any day that I get to provide a mother extra support is a day that is a good day, and it's just a job I love.